After weeks of public conversations, Ada County commissioners made their decision today to select Dr. Ryan Cole to fill the vacant physician position on the Central District Health Board. That name may be familiar to you because Dr. Cole has been making a lot of headlines lately after announcing his candidacy for the opening. Dr. Cole currently runs his own testing laboratory in Garden City, and he previously received pushback from other medical professionals and the community as well after he made comments critical of the COVID-19 vaccine. We're going to have more on that coming up in just a bit. But soon after the decision was made today, we saw a lot of questions and comments from the community about this decision and why each commissioner voted the way they did. And so Joe Paris is in studio with us right now to kind of talk with us about that and kind of break it down and how this decision quickly created a controversy.
Yeah, Brian, Dr. Cole was selected by Ada County commissioners in a 2-to-1 vote earlier today, this morning. Commissioners Ron Beck and Ryan Davidson both voted in favor of Dr. Cole. Commissioner Kendra Kenyon was the lone no vote. Now, the decision now goes for an approval vote for commissioners in the CD8 zone. That includes Valley, Elmore, and Boise counties. They'll need to approve the decision by a simple majority, and we'll keep you updated as that goes on. But the question we've seen from the community: why was Dr. Cole selected? Well, both Beck and Davidson spoke in favor of Dr. Cole, but made a strong case that their decision was based on input from the public. Commissioner Davidson said that the current health decision status quo is not working for this community, and Dr. Cole brings an alternative view to that. Here's a look at some of the explanations from Mr. Beck and Mr. Davidson on why they decided to vote for Dr. Cole.
The vast majority of the emails we received, and from my own personal investigations, I would go to Dr. Cole if I had a medical issue. I would trust him thoroughly.
I think he has some interesting ideas that we need to introduce into the public discourse. Basically since the pandemic has started, we've gotten the same message from the federal government, which is mask, social distance, vaccine. Mask, social distance, vaccine. And really that message hasn't changed. And even with that, our vaccination rates have kind of maxed out at approximately 60% is what the information we're getting.
Commissioner Kendra Kenyon had a polar opposite view from those gentlemen, saying that she was, quote, adamantly opposed to having Dr. Cole selected. Now, Commissioner Kenyon touched on comments that Dr. Cole has made throughout the pandemic. Those include heavily critical statements against the mRNA COVID vaccines and the overall handling of the pandemic. Here are some of Kenyon's thoughts on why she did not support a vote for Dr. Cole.
Dr. Cole, I think he brings the outsider view, like Commissioner Davidson said, to the table. And, I think that's needed. But again, I'll reiterate, not in this position. I think comments he's made calling the vaccine a clot shot, needle rape, saying vaccines are poisonous, they're killing our population, we have to stop them now. When he turns around, he makes money off of it and his own family's vaccinated. Just flies in the face of ethics to me. So I'm really disappointed.
So when she just said that Dr. Cole was making money off the COVID situation, Commissioner Kenyon is referring to Dr. Cole's business operation, which in fact, in part, does process COVID tests. Now, it was clear that the top two choices for the opening were Dr. Cole and Dr. Sky Blue. Dr. Blue is an infectious disease expert and epidemiologist in the community, and he too saw large support from the community during this process. Now, Commissioner Kenyon had this to say to her fellow commissioners on their decision to select Cole over Blue.
I think it's a sad day when this body would go against our medical community. St. Luke's has weighed in, St. Al's has weighed in, Primary Health has weighed in, the Veterans Administration, our hospital has weighed in, numerous doctors have weighed in, that Dr. Sky Blue, the infectious disease expert, should be the #1 choice. The fact that we have an expert candidate who's willing to volunteer for this position, and we're willing to overlook that in light of the fact that the entire medical community is behind this candidate is just, to me, it's a sad and disappointing day.
Real quick, Kenyon did clarify that she meant a large majority of the medical community supported Dr. Blue, correcting the statement she did not mean the entire community. So why were Davidson and Beck against selecting Dr. Blue? Well, Davidson made it a point to criticize local health systems and their handling of the pandemic. Specifically, he criticized the move that some health providers have made recently, requiring staff to get a COVID vaccine to maintain their employment. The rationale is to keep vulnerable people needing treatment from getting a deadly COVID infection while at the doctor or hospital. Now, Davidson has a problem with that, and it factored into his decision.
You know, that troubles me a lot. It troubles a lot of people in the medical community a lot. There's been a lot of protests going on. Yeah, that's my concerns with the, the medical community at the moment, is that they're leading us down a path, and I don't see Dr. Sky Blue as maybe standing up to that, where perhaps Dr. Cole will.
Okay, so they paid attention to the emails sent in on this decision, but not to the one sent in when it came to appointing Raul Labrador.
Yeah, people have commented to us today, Brian, that earlier this year when Raul Labrador was appointed to the CDH board, there was an email campaign that was heavily against that appointment that ended up not making a difference. Of course, Mr. Labrador is still on the CDH board.
All right, thank you very much, Joe.